everyone. Today's practice will be focused in the hospital bed. Many of you I work with in the hospitals, and it's very important to optimize your treatment by working as much as you can, even if you are relegated to being in your bed for a week or even 3 weeks or even 3 months, that we boost the immune system, we strengthen the muscles where we can, we relax the nervous system, and we just help stretch the body from the aches and pains that go along with just being in a hospital bed for a long time. So what we're going to be doing today is a practice where we'll have the bed up and we'll also lay the bed flat. So before we get started, one of the most important things that you can do is make sure that your IV line is free and clear from the sides of the bed. Also, just taking care, because I know it can be a really sensitive area around where the IV is in, just making sure that it's nice and taped on, or again, the IV line itself is a little loose. So let's get started. So roll your blanket back all the way to the bottom of the bed. I know a lot of people I work with like to bring their own blankets in for a little touch of home. Also, people like to bring in their own pajamas aside from the hospital gown. It's just something to help you feel a little bit more comfortable. Just little tips along the way that I've learned from people I work with. And we're going to start by taking the bed down. So just using the side of the bed, making sure your IV line is free and clear. Take the bed all the way down to a flat position. It's very important here to make sure that you're completely comfortable lying flat. If you are not, raise the bed back up to where it was so that you just feel completely comfortable. This is meant to relax the body and optimize the strength in the body. It should feel very comfortable for you. So the first thing I'll ask you to do is just close your eyes. Feel the bed, and what I mean by that is feel the heels into the bed. Feel the backs of your legs, your hips, the lowest part of your back, the middle part, your shoulders, and your head resting on your pillow. Take a nice inhale, nothing forced, just a nice normal inhale, and exhale just a little longer than your inhale. Do that a few more times on your own, noticing how you're breathing. And what I mean by that is, notice if it's smooth and slow and fluid when you inhale, or if it's sticky or clunky or short. And there's nothing wrong or right with either one of those. I just want you to understand and get just a little used to noticing how you're breathing. Still keeping your eyes closed, let's go ahead and point the toes. Then flex the feet and point the toes. And flex the feet and point the toes. And let's just keep doing that a few more times at your own pace, knowing each time you're flexing and pointing your toes, you're actually contracting and moving your calf muscles, which activate your heart, which help boost your circulatory system, moving lymph around in your body as well. Relax the feet, and you can softly blink open your eyes. Let's rotate the ankles to the right. Just slow, nice movements, really feeling everything pop and stretch and move. Noticing how your ankles move around. And let's go to the opposite side. Again, working the calf muscles, boosting the circulatory and the lymph system. And relax the feet. Let's inhale, reach the arms straight up. Exhale, lower the arms back down. Inhale, reach the arms up. And exhale, lower the arms down. One more time, inhale, lift the arms up. And exhale, lower the arms down. Now, let's take one leg at a time. So bring your right knee up towards your chest. Take your hands around your knee. And you can clasp the fingers if that feels good to you. Hug the knee in toward the chest. Or, if that's not comfortable, you can bring the knee out slightly toward the right shoulder or the opposite side of the bed. Just holding that there, taking a nice inhale and an exhale as long as you can. And take one more actually. Let's take a nice inhale together again. And an exhale as long as you can. Let's bring the knee back center and extend that leg along. From here, let's bring the left knee in. Same thing, wrap the hands around just below the knee. You can bring the knee in a little closer toward your chest. Just noticing if this side feels any different than the other side. Although our bodies are quite symmetrical, they're not always symmetrical in how the muscles feel every day. Remember that you can bring the knee out to the side toward the left shoulder just as you did with the other leg. Just feeling that stretch. It might be a little tight through the inner thigh sometimes after you've been in a hospital bed for a while. And then let's move the legs down. So from here, let's flex both feet, and I want you to put your hands on tops of your thighs. See if you can feel the muscles flex when you really flex the feet. And I want you to flex the feet so hard, almost like you're pushing your heels into a wall in front of you. And relax the thighs. Let's do that 3 more times, holding it for 5 seconds each. Inhale and flex the feet, and exhale, keep holding. One more inhale and relax the feet. Let's do that again. Inhale, flex the feet, really push through those heels. Exhale, inhale, and relax the feet. Last time. Inhale and really flex the feet, really give it your best shot. Exhale, and inhale, and relax the feet. Shake the legs out a little bit. Really notice how the tops of your thighs feel. They should feel a little tired from that. You just built the muscle on the top parts of your thighs, which is going to help you be able to get in and out of your hospital bed on your own if you work to flex and strengthen these muscles. Okay, so from here, let's hug the right knee back in and bring the left knee up with it if that feels comfortable. Bring both hands to the outer side of where the shins are and just give just a little hug. Now from here, if it feels comfortable, lift the head up off the pillow and round the neck, lower the chin, and take the head back. Take the hands on the top parts of the knees. As you inhale, I want you to move the knees away from you until your arms straighten. Exhale, bring the knees in again. This is an incredibly helpful movement if you are constipated or having trouble going to the bathroom. Inhale, move the knees away slowly again until the arms straighten. Exhale, bring the knees back in. Let's do it one more time. Move the knees away. Exhale, bring the knees back in. Wrap the hands around the shins. Give yourself one more squeeze. Tuck the chin forward and relax it back down. Now from here, keep the feet right underneath your knees. Arms are straight by your sides. Neck is nice and long. Press the heels down into the bed. And as you do, lift the hips slightly in the air. So all you're doing is lifting the hips and the buttocks off the bed. Lower the hips back down. You only need to lift up about an inch. It doesn't have to be very far. So lifting, inhaling again, pressing the heels into the bed, giving a gentle squeeze of your bottom, and then lower the hips all the way down. And let's take one more. And this time let's hold it there. So hold it there as long as you can. Give a gentle squeeze. And relax all the way back down. Now, the next posture we'll do is incredibly helpful for stretching the lower back, which I know for people I work with get so sore and so stiff from being in the bed. Take your right ankle, if you can, and cross it just above the left knee. Now, you might have really tight hamstrings, and this may be really difficult for you. And if it is, just cross the foot just so that it's on this side of the knee. Just rest it there. It doesn't have to be fully above where the left knee sits. If you're able to, take both hands, reach through, and grab behind the left leg. Use the hands to pull that left knee toward your chest, clasping your hands either behind your leg or just on the sides of the leg. This right here might be enough of a stretch for you that you don't need to do anything else. If you have a bit more flexibility, use your right elbow to press into that right leg. Keep flexing the right foot and the left foot to protect the knees. And you could even try pulling the knee even closer in. Let's take 3 inhales together. Inhaling and exhaling. Take another inhale and exhale as long as you can. And let's start to lower the knee down and the foot down. Take one more inhale and exhale, release that foot. Now just to neutralize the spine, let's take one more hip lift where we'll press the heels into the bed, lift the hips up one more time, and exhale, lowering the hips back down. Let's repeat on the opposite leg. Again, crossing the foot above the knee. Remember, each side of the body is different, right? So this side might be more flexible or it might be even tighter. Just listen to your body. And if it feels too tight, maybe just even open the leg like this. That could be an option for you too. If it feels comfortable to keep the foot there, flex the foot, reach through with both hands, grabbing behind the right thigh, pulling that right knee in. So see, my left side is tighter for me today. So I can't pull my knee in as far as I did, and that's okay because each side just needs to stretch and move. Notice how my right foot is as flexed as my left. Use the left elbow if that feels okay to press away from you. Keep relaxing the shoulders. Let's take 2 full inhales and exhales. And exhale. Another inhale. And an exhale. And let's relax the foot down. take one more inhale. Exhale as long as you can. And then a couple more postures. So from here, let's take care to watch your IV line, and let's just move the arm up a little bit more. We're just going to windshield wipe the knees, gently and slowly moving the knees from side to side. Let's just do this a few times. Just moving the knees, and one more time to the left and to the right. Now let's take the knees all the way to the left and keep them here. Look over toward the right. Just giving your spine a little gentle twist. You can hold these twists several breaths if you like. For us, we're going to bring the knees back center and over toward the right. Look over toward the left. Again, noticing the difference between the sides of your body. How fascinating that is, that every side is different, right? Taking a couple more breaths on your own. And bring the knees back center. Let's extend the legs long and start to sit the bed upright. Watching your IV, making sure that it doesn't get stuck. And sit your bed up as far as you can take it. All the way up if you can. And that'll be perfect just like that. Now, from here, let's take the arms straight out forward, inhaling. And as you exhale, let's take the arms into what we call a cactus. Or for those of you that are football fans, you can call it goalpost arms. Inhale, reach the arms forward. Exhale, bring the arms back into cactus. And inhale, reaching forward. And exhale, bringing into cactus. Bring the right arm forward. Take the left arm underneath if you can. And it's okay if you can only get your arms as close together as this. You can even press the elbow into the forearm. If you can get it a little closer, what feels nice is to just grab a hold of the fingers, just like so. Just lift the elbows up and just pull the shoulder blades toward each other. This is an amazing stretch for the neck and the upper shoulders and upper back, which also gets incredibly tight and stiff when you're in a bed for very long. Relax the arms down. Take the arms down by your side. Just give yourself a moment. Extend the left arm straight up again. Take the right arm underneath it. Again, different side of your body. Could feel totally different. Take the two elbows together. Elbow goes into the crease of the opposite elbow, touching the backs of the hands or maybe looping a finger. Lift the elbows up, pull the shoulder blades inward. Take a nice inhale and an exhale. And relax the arms back down. Something so simple, yet so good for your neck and your back. Let's bring the elbows in toward the sides. Squeeze the palms together, really squeeze. Extend the fingers. You want nice big jazz hands. So you want to spread the fingers as wide as you can. Make a fist, inhaling. Exhale, release. Inhale, squeeze. Exhale, release. One more time, squeeze. Exhale, release. If your IV starts to feel a little intense when you do the squeeze, just don't squeeze as hard. You can still expand the fingers to get the blood flow into the fingers. Now gently hold the hands in a little bit of a squeeze, nothing too tight. And let's just gently rotate the wrists. Now remember that the wrist you don't have your IV in may have better range of motion, and that's because you can't really bend it too much at the wrist, right? Go opposite direction, that's okay. Let's keep moving with some flexibility, just small, small motions. And relax the hands, relax the fingers. So from here, let's do just a couple more exercises for the neck. Let's take the head to the left, lower the chin slightly down, bring the neck back up with the chin, through center, over toward the right, lower the chin down, lift the chin back up, and center. Relax into the bed, relax the body. Let's do just a few rounds of breathing so that you can reap the benefits of all of the movement and work that you just did. So we're going to learn a breathing technique that's incredibly good for if you're feeling a little anxious, you might be feeling a little nausea, anything like that. It's inhaling for 4 counts and exhaling for 4 counts. And you're just focusing on the rhythm of your breath. So take a regular, nice, normal inhale and a nice, normal exhale. Inhaling 1, 2, 3, 4. Exhaling 4, 3, 2, 1. Inhaling 1, 2, 3, 4. Exhaling 4, 3, 2, 1. Inhaling one more time, 2, 3, 4. Exhaling 4, 3, 2, 1. Relax the body, relax the breath. Notice what feels different in your body than it did when we first started. Notice what might feel even better or good in your physical body, in your mind, your emotions. Something that feels better than it did when you first started. Take one last moment here to think of something you're grateful for. Maybe it's a person, an animal, a thing, maybe even just gratitude itself. Whenever you're ready, softly blink open your eyes and honor yourself for empowering yourself to take charge of your health when you're in the hospital, when you're getting treatment, for doing something to boost your immune system, to build strength, to build any type of anything in your body. You did it all on your own. Thank you so much for joining me today. We'll see you soon.